Hi, I'm Dr. Kavita. Please do watch, share, subscribe to my channel. In this part of the video, I'm going to tell you about neurology in women in detail. I have worked as a neuro resident for almost 10 to 15 years. So I give a brief description of the neurology in women. Neurology in women is a broad and complex topic as neurological conditions can manifest differently in women compared to men due to hormonal, genetic, anatomical, and social factors. Coming to overview of neurological differences in women. Women's neurological health is influenced by a combination of biological and environmental factors. First one, hormonal influences. Estrogen, progesterone, and other hormones fluctuate across a woman's life during menstruation, pregnancy, and menopause and impact brain function, neuroprotection, and disease progression. Second thing, brain structure and function. Women's brains show differences in connectivity, volume of certain regions like hippocampus, amygdala, and neuroplasticity compared to men, which can affect disease susceptibility and recovery. Third one, genetic factors. X-linked genetic disorders, for example, like in Rett syndrome and mitochondrial DNA mutations, disproportionately affect women or manifest differently due to sex chromosomes. Fourth one, social and environmental factors. Women may face unique stressors. For example, they play caregiving roles, socioeconomic disparities, which influence mental health and neurological outcomes. Common neurological disorders in women. Certain neurological conditions have higher prevalence, unique presentations, or specific considerations in women. Some of the examples are: first one, migraine. Women are 3 to 4 times more likely to experience migraines than men, with a lifetime prevalence of 25% in women versus 8% in men. Hormonal links in migraine. Estrogen fluctuations, for example during menstruation, pregnancy, or menopause, can trigger migraines. Menstrual migraines affect 20 to 60% of women with migraines. How do they present? Presentation. Women often report longer, more severe migraines with associated symptoms like nausea, photophobia, and they may have aura also, like visual or sensory disturbances. What are the treatment considerations in migraines in women? Hormonal therapies, for example, oral contraceptives, can worsen or alleviate migraines depending upon the individual. Pregnancy often reduces migraine frequency, but postpartum hormonal drops can trigger attacks. Triptans and preventive medications, for example, beta blockers, anti-seizure drugs, are commonly used, but women may require tailored dosing during pregnancy or breastfeeding. Research purpose. Studies suggest estrogen modulates pain pathways and serotonin receptors, contributing to higher migraine susceptibility in women. Second one, multiple sclerosis. Prevalence. Women are 2 to 3 times more likely to develop multiple sclerosis, with peak onset in reproductive years around 20 to 40 years of age. Hormonal influence. Estrogen and progesterone may modulate immune responses, as multiple sclerosis is an autoimmune condition. Pregnancy often stabilizes or improves symptoms due to immune suppression, but relapse risk increases postpartum. How do they present? Presentation. Women are more likely to have relapsing remitting multiple sclerosis than progressive forms. Fatigue, sensory disturbances, and motor weakness are common. What are the treatment considerations in multiple sclerosis in women? Disease modifying therapies, for example interferon beta, natalizumab, are effective but require careful management during pregnancy. Hormonal changes, for example menopause, may alter the disease course, with some women experiencing worsening symptoms. Research purpose. Sex differences in immune response and brain repair mechanisms, for example remyelination, are areas of active study in multiple sclerosis in women. Women may have better outcomes in early disease stages due to neuroplasticity. Third one, Stroke prevalence. Women have a higher lifetime risk of stroke, 1 in 5 women versus 1 in 6 men, partly due to longer life expectancy. Risk factors which are unique to women with risk of stroke. Pregnancy related conditions, for example, preeclampsia, gestational hypertension, increased stroke risk. Oral contraceptives and hormonal replacement therapy can elevate risk, especially in women with other risk factors who smoke or if the woman has hypertension. Atrial fibrillation, more common in older women, is also a major stroke risk factor. Presentation. Women may experience atypical stroke symptoms such as fatigue, confusion, or generalized weakness, leading to delayed diagnosis. What are the treatment considerations for stroke in women? Thrombolytics, for example, tenecteplase or alteplase, and endovascular therapies are equally effective in women, but access to timely care can be lower due to misdiagnosis. Post stroke recovery may be slower in women with higher rates of depression and disability. What is the research purpose of stroke in women? Women have worse post stroke outcomes, potentially due to social factors, for example, less caregiver support and biological differences in neurovascular response. Next, Alzheimer's disease and dementia. Prevalence. Women make up 2/3 of Alzheimer's disease with a lifetime risk of 1 in 6 compared to 1 in 11 for men. Risk factors. Longer lifespan increases exposure to age-related risk. Menopause-related estrogen decline may reduce neuroprotection, accelerating cognitive decline. ApoE4 gene variant, a major Alzheimer's disease risk factor, has a stronger effect in women. How do they present? Women may show faster cognitive decline and more pronounced verbal memory deficits. Behavioral symptoms, for example, hesitation, are also common. What are the treatment considerations for Alzheimer's disease in women? Cholinesterase inhibitors, for example, donepezil and memantine, are standard but show no sex-specific efficacy differences. Hormone replacement therapy's role in Alzheimer's disease prevention remains controversial with mixed evidence. Research insight. Estrogen's role in neuroprotection and inflammation is a key focus. Women may benefit from early interventions targeting cardiovascular health. Next, epilepsy. Prevalence is similar in men and women, but women face unique challenges due to hormonal influences. What is the hormonal link of epilepsy in women? Catamenial epilepsy, seizures tied to menstrual cycle, affects 40% of women with epilepsy. Pregnancy and menopause can alter seizure frequency. What are the treatment considerations for epilepsy in women? Anti-epileptic drugs like valproate and topiramate require careful use in women of childbearing age due to teratogenic risks. Hormonal therapies, for example, progesterone, may help manage catamenial epilepsy. What is the research purpose? Sex differences in epileptic drug metabolism, for example, faster clearance in women, may require dose adjustments. Next, Parkinson's disease. Prevalence. Less common in women, 1.5 to 2 times higher in men, possibly due to estrogen's neuroprotective effects. Presentation. Women may have milder motor symptoms but higher rates of non-motor symptoms, for example, depression, anxiety, fatigue. Treatment considerations for Parkinson's disease in women. Levodopa and dopamine agonists are standard, but women may experience more side effects, for example, dyskinesias. Hormonal fluctuations can affect symptom severity. What is the research insight? Estrogen's role in dopaminergic pathways may explain lower prevalence in women. Next, sex-specific neurological considerations. For example, pregnancy and neurological health. Pregnancy alters neurological conditions due to hormonal, immune, and vascular changes. Migraine often improves during pregnancy, but postpartum flares are common. Multiple sclerosis. Reduced relapses are seen during pregnancy, increased postpartum risk is present. Stroke. Risk increases during pregnancy due to hypercoagulability, especially in women with preeclampsia. Epilepsy. Seizure control may change. Antiepileptic drugs require monitoring to avoid fetal harm and teratogenicity. Management. Multidisciplinary care with neurologist obstetricians is critical. Medication adjustments and monitoring are tailored to balance maternal and fetal health. Next, menopause. Estrogen decline affects neuroprotection, cognition, and symptom severity in conditions like Alzheimer's disease, Parkinson's disease, and migraine. What are the treatment patterns? Hormonal replacement therapy benefits cognitive protection and risk, for example, stroke, vary by timing and formulation. Individualized approaches are needed. Hormonal replacement therapy has benefits as well as risks. There is a risk of stroke and there is a benefit of cognitive protection. Next, autoimmune neurological disorders. Women are more prone to autoimmune conditions like multiple sclerosis, neuromyelitis optica due to immune system differences. Estrogen may enhance immune responses, increasing susceptibility. Next, mental health and neurological overlap. Women have higher rates of depression and anxiety, which often coexist with neurological disorders like post stroke depression, multiple sclerosis related mood disorders. Hormonal fluctuations exacerbate psychiatric symptoms, requiring integrated neurological and psychiatric care. What are the emerging research and trends in neurology in women? Sex specific biomarkers. Research is exploring sex specific biomarkers, for example, tau in Alzheimer's disease, inflammatory markers in multiple sclerosis, to improve diagnosis and treatment. Neuroimaging. Studies show women have different brain connectivity patterns which may influence disease progression and recovery. Precision medicine. Tailoring treatments based on sex, genetics, and hormonal status is a growing field. Social determinants. Access to care, socio-economic status, and gender biases in healthcare affect women's neurological outcomes. What are the practical recommendations? Screening. First one, screening. Women should be screened for neurological risk factors, for example, hypertension, migraines, during routine care, especially during pregnancy or menopause. Next, lifestyle. Cardiovascular health, for example, they should maintain their exercise schedule. They should maintain their diet schedule, which is very critical as it reduces risk for stroke and dementia. So, maintaining cardiovascular health in women is a must. Women should advocate for comprehensive evaluations as symptoms may be dismissed as hormonal or psychiatric. Means they have to rule out whether they have any psychiatric disturbances or hormonal disturbances. Research participation. Encouraging women to participate in clinical trials can address knowledge gaps. Conclusion. Neurology in women is shaped by a dynamic interplay of biology like hormones, genetics, and environment. Conditions like migraine, multiple sclerosis, stroke, and Alzheimer's show distinct patterns in women requiring tailored approaches to diagnosis and treatment. Ongoing research into sex specific mechanisms promises to improve outcomes, but challenges like underdiagnosis and access to care persist. For personalized advice, women should consult a neurologist familiar with sex specific considerations. Thank you. Please do subscribe to my channel. Please do watch, share, subscribe to my channel. Thank you. Medical students, what do you read about? What is the intensity of multiple sclerosis in women? What is the risk factors for migraines in women? What is the hormonal link for migraines in women? What is the treatment of migraine in women? How do we analyze migraines in women? What are the risk factors for multiple sclerosis in women, and what type of multiple sclerosis are women affected to mostly? What are the various types of strokes in women? What are the risk factors for stroke in women? What are the treatment considerations for stroke in women? How often do we see a woman in OPD with Alzheimer's disease and dementia? And how do we treat and give supportive care to women with Alzheimer's disease and dementia? What are the treatment considerations for anti-epileptic drugs in epilepsy in pregnant women? What are the teratogenic anti-epileptic drugs? How do we treat Parkinson's disease in women? How neurological health affects pregnancy? How do we manage pregnancy related neurological issues? Read all these about. Thank you. Please do watch, share, subscribe to my channel.